All right, everybody hear me? Hard for me to talk for just 10 minutes about chiropractic, but I'm going to try to do it. How many of you have ever been to a chiropractor before? Good, that's a big number. How many of you have ever been to a chiropractic patient education class? That's what we typically see. That's one of the things that I realized in practice is that for most of us as chiropractors, we fail in educating our patients on what we do, why we do it, and how that makes you healthy. Because like Dr. Anderson was talking about, why aren't doctors talking about this? Chiropractors have been talking about it for 100 years. Because we realize that some of the core principles of chiropractic are what are now becoming new and revolutionary when it's really been around for a long time. One of the things I like to thank Dr. Anderson for having me out here. I really appreciate getting to talk to people who are concerned and have an interest in their health. People view chiropractors as the back pain doctor. I get patients who tell me, I don't need to see you because my back doesn't hurt. And that's what I'm here trying to make people understand. It's like saying, I don't see a dentist because I don't have cavities. I don't do preventative maintenance because I'm not hurting yet. I always like to start with this quote, kind of going back to what he was talking about earlier. The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. How many of you ever heard that quote before? Do you know who said it? No. Thomas Edison, 1902. So, Thomas Edison saw the course of medicine 110 years ago. Chiropractic began in 1895. And so, what I want to explain to you all today, just for a few minutes, are what I call our core concepts, and there are 4 of them. And the concepts that I'm trying to educate you about are not new, they're not revolutionary, they're just so simple that they're often ignored. Concept number 1. Here's the big one. Here's the big shocker. You were born to be healthy. Crazy, isn't it? Especially if you watch the evening news. That's when the drug makers are targeting you. You can't urinate. You can't sleep. You can't have sex. You're depressed about everything. So ask your doctor if this pill will help. But it may cause bleeding from the eyes. You may get more depressed. I love the one for depression. It may worsen your depression or give you suicidal thoughts. Does that make sense? No. And that's what I thought as a chiropractor. It's like, that really makes sense. You're meant to be healthy and vital and live your life. Health does not come in a pill. Everything we have inside us is meant to make us healthy. We spend, we're number 1 by double of the rest of the world of what we spend on health care. And yet we're in the low 20s and upper 30s on longevity and wellness. So obviously the money spent on it is not getting us anywhere. Because these new miracle drugs and miracle cures are really just miracle drugs. But the same problem still exists. Concept number 2. Your nervous system controls everything. It controls everything. So, what we look at as chiropractors is if your nervous system is functioning properly, you function properly. So, what is the most important organ in the body? Your brain. Heart's pretty important, but you can do heart transplants, kidneys, liver, all that. You can do all those kind of transplants. Your brain. Because your brain controls everything in your body. Without your brain, you're not living. Now, how does your brain talk to the rest of your body? How does your brain tell your toe what to do? Through the nerves. So where do the nerves pass through to get to your toe down here? Your spinal cord, which passes through your spine. What do chiropractors treat? The spine. Exactly. I'm not a back pain doctor. I'm trying to optimize your nervous system. Because when your brain can talk to the rest of your body works like it's supposed to. It's like a good connection on a telephone. If everything's coming through, the message goes through. But if you're at the edge, if you're not getting a very good signal, you don't get quite all the message. You may get enough of it, but it may be confusing. So what happens? You're not sure what to do. Same way your organs are. So if your brain can't talk to your toe, maybe that toe's cramping at night. You're like, what in the world is going on? But it passes through that spine. And so, our concept number 3, interference to the nerves affect their function. They cause pain at the site of injury or damage, and problems where the nerves go to. So not only causing pain, but also causing problems in those organs too. So let's talk about that toe again. That nerve come out of the lower lumbar spine, the very bottom bones in your low back. What Dr. Anderson was showing you where he has some problems. Make it a sciatic nerve. But those nerves also go to your bladder, your colon, prostate, pelvic organs, the uterus, the ovaries. So problems there. A lot of times patients won't tell me because I'm dealing with their back pain, but they won't tell me that, yeah, I've got severe sciatica and hardly sit down. I'm also constipated. I'm also having bladder issues. I have bladder pain, but my doctor says I don't have an infection. Why? Because it's a bad connection between the brain and the rest of the body. Because the power that made the body heals the body. If I cut your arm, what happens? It starts bleeding. But then what happens? It starts to clot. It starts to heal. Do you have to think about that process? Do you have to focus on it? All right. Can't do anything else. I'm focused on healing my arm. You don't have to think about it because the brain controls it all. Now what if I cut a steak? It doesn't heal. Maybe my wife will. She likes a little rare. It doesn't heal. What's the difference? There's none of that power that made the body heal in the body. The Greeks called it physis. Asian medicine calls it chi. Biblical scholars call it the spirit. What makes a dead person dead? The lack of that makes somebody dead. When you have it, it makes you alive. So if that energy that tells our body what to do can function, our bodies function. When you don't have the function, things start becoming dysfunctional. And when you have dysfunction, you start having disease. And when you have disease, that's finally when people start seeking out things to happen, things to make them feel better. The sad thing is, when people have pain, 20% of our nervous system is sensory, telling us what we feel and how we feel. 80% of it is function. So by the time that you get to pain, 80% of your nervous system is already affected. And so if you just focus on the pain, the other 80% still doesn't help. So let me ask you this. What do people reach for when you get back pain? Advil. Now, Advil burns a hole all the way through your digestive system, causing leaky gut, gives you ulcers, kidney damage. All those issues coming from NSAIDs, naproxen, all those do that. And does the Advil go down and fix the little parts of your spine that are dysfunctional? No. They flip that switch up here. Do you get a headache because your body's deficient in Advil? Did your back hurt because you're not getting enough Tylenol in your diet? No. They don't fix anything. They just turn that switch off for a little while it continues to wear the process out. You take away the pressure, the interference, the body can heal itself. That's what it's meant to do. Concept number 4. Health is a journey, not a destination. If you don't maintain it, you will lose it. How old is the oldest person you know? Anyone? 103. I know a 103-year-old. 105. Here's the scary thought, folks. There's a good chance, I guess it could be scary, it's really pretty good, there's a good chance you're going to live to be 100. You need to prepare for that. You need to prepare financially, but also medically and health-wise. Because you want to keep living until you're dead. Because a lot of people stop living, but they're still alive. And the better maintained your body is, the better you're going to function through that 100 years. You don't want to be alive in your 90s, but you stop living in your 70s. That's what I see with my patients, my healthy, active patients. They live until something really bad happens to them. But my patients who are sickly, they don't make it out of their 70s. Their 70s get them. So good sleep, good exercise, and real food are the things that will make you healthy. They're so basic. It's so simple. If God didn't make it, you shouldn't eat it. My clinical nutrition professor, that's what he would always say. If an ant won't eat it, you shouldn't either. Because it's not real. You put Splenda out there on the ground, ants will make a path around it. Because it's fake. It's not real. It's something that's not made by nature. And we put it in our bodies, it tears us up all the way through. So before you take those NSAIDs, think, is this fixing the problem? Is my problem a lack of Advil? Or is my problem something pressing, irritating a nerve, causing my body to be dysfunctional? And don't even get me on the narcotics, the opiates. You know what the scary thing is, folks? Narcotic pain medication kills more people in this country every year than all illegal drugs combined. Just say no to drugs unless somebody in a white coat hands it to you. And opiates, they shut down your whole system. Constipation is huge with opiate use. I think that's what got Elvis. He was a heavy narcotic abuser. His colon was just huge because everything in the body stopped. I appreciate the opportunity to have a few minutes to talk to you about chiropractic. Because I want you to understand that there's a different way of looking at your health. Because you really got to look at you. Only you can affect your health. It's not going to be there in a pill or surgery. One of the things I also say, if God put it in you, you shouldn't take it out. If He didn't put it in you, people ask me, well, should I go get my back fused? Well, God said you need 5 vertebrae, you're going to fuse 3 of them. What's going to happen to the other 2? They're going to wear out. People ask me, how long do I have to keep getting adjusted? I said, only as long as you want to feel good. It's like asking a dentist, which teeth am I going to brush? The ones you don't want to lose. Folks, I appreciate the time. Y'all have a great afternoon. Some great stuff from Dr. Anderson. Thank you.